Alright, so the start of this video is me getting the blood pressure, and since my participant is a child, I was able to get a child cuff from my work, which was pretty nice of them, I thought. Here you can see I'm just lining up the where it shows you the artery. You're putting this to the brachial artery, and on this first one, you'll see that I kind of make a mistake, and I kept it in there because I think it's important to notice that there's a lot of little things that go into taking a blood pressure. Luckily for me, I've been a paramedic for about the past 7 years and EMT before that, so I've taken well over probably 10,000 blood pressures. But as you can see here, blood pressure set, and when you want to do this, you want to keep the patient's arm at heart level, make the arm relax. And as you see, I use my fingers and not my thumb on the bell of my stethoscope because sometimes a thumb can have a pulse in it and it can throw you off. I also want to make a note to show that you want to keep the tubing from your stethoscope, as well as the tubing from your the bulb aspirator, as well as the tubing from the cuff. You want to keep those separate because the clinking of those together can give you a false reading, thinking that maybe you're hearing the systolic the first sounds of the systolic blood pressure, and it's actually just the artifice of the tooth hitting together or your thumb pulse. And as you can see here, I get a bad reading because I'm too far off to the side and I'm not actually seeing the numbers directly on as the camera is seeing them. So when I did this, I actually got a higher reading than it actually was, and this reading was different from all of the other readings that I got. So as you can see all right here, I believe this blood pressure was a 116 over 70, let's see, 116 over 76, and although not bad, that's still probably not a healthy young child at rest. Normally falls more into the 90s range, which you'll see on these next three blood pressures. So, one more thing I'd like to note is a common mistake is the stethoscope. You want to make sure that the earbuds are pointing towards the eardrums. So when later on in this video, you'll see that I show it's kind of pointing towards your nose is how you want to think of it. That way you can hear the sounds better. Also, another quick little trait is when you want to do a blood pressure over palp. This is sometimes utilized when like really low blood pressures or when it's just really faint pressure and hard to hear. You can pump up the blood pressure and you can feel for the radial pulse, and you do it the same as if you're listening through a stethoscope, but you just wait until you can no longer feel the pulse, and then you have your blood pressure of systolic, but you will not get a dystolic with this type of blood pressure reading. So this was my 4 blood pressure attempts, and now let's go on to the waist and hip ratio. First one was not probably correct, so okay, we'll try that one again. Yeah, it is 4 times right here. This one and that one will try. Okay, not hurting or anything.
Not really, but kind of. It's okay.
So in this video is my attempt of doing the waist to hip ratio. And when you're doing this test, you just want to make sure that your tape is parallel to the ground. You want to go right around the umbilicus cord. Umbilicus cord. You want to go right around the belly button, and you want to have the patient just completely relax, not try to suck in the stomach or stick out their stomach. And as you see, or as you will see, it is a little bit more difficult with the younger children because they want to look down, they kind of want to move. So you just got to be aware of that and also be ready for it. And for the most part, I got about the exact same readings, right about 65 centimeters on the waist, and then also right around 65 centimeters on the hips. So anyhow, this still helped. According to the results, shows that she's fallen within normal limits for her age, rate, height, and weight. Centimeters from there. Go around the hip here. And this stuff is a little bit less than this right here. 65. Sorry, 65 and 65 on this one. And for the fourth and final one, here we go. Yes. Okay, sure up. Arm slide. Put your arms down. Put your arms down yourself. I'm sorry, hold your shirt up. And this one we get 64 and a half. And on the hip. 64 and a half. Okay. So in this video, we're doing the skin fold millimeter test here, and the 3 sites I use is the tricep and the abdomen and also the calf, because when I looked at the textbook on page was it 267 through 37, it was saying for children, women young women from 6 to 17 years old. The sites you want to use triceps plus the calf. But since we want, it looked like we wanted 3 sites at 4 measurements, so I went into the abdomen in there. You can also use the super iliac, which is right above that crest line. When I did perform these tests, I got around the exact same measurement each time, as you'll see. I got about 15 to 14 millimeters was the normal skin fold results that I got for each test. Sometimes, like as I said, you can see she's a young child, and it gets harder for her to sit still. So sometimes the readings were different, but once we were able to get back to the correct position, you can see that each one falls in the same vicinity, all of which were showing that she is within the normal limits of the skin fold test and BMI results. We're at 14. Okay. Relax, and we're going to do that 3 more times. So. There it is. So it's right at 14. Down to the calf. So this one actually goes down to about 12 on this one. Right at 15. Okay, shake it off. Okay, we're gonna have 2 more times with this. Ready? Relax your leg, Riley. Relax your leg, honey. Okay, now we're going to relax your leg. There's a good one. Right about. Relax your stomach. Sorry. Okay. Now 1 more round we got, okay? So. Here, relax this leg. Relax this leg. Just completely relax it. Got so much muscle in here.